Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of the show, bringing another really awesome guest for you today. Today on the show, we have the honor of being joined by Dr. Aaron Hartman, who is a board-certified physician, a clinical researcher, the founder of Richmond Integrative and Functional Medicine. And Dr. Hartman trained in conventional family medicine. He earned his MD from the Medical College of Virginia, went on to serve as a major in the United States Air Force, where he led various medical clinics in both the United States and Europe, and along the way received additional training in cardiology and dermatology, as well as nuclear and biological warfare countermeasure medicine. And over the course of his career, he has participated in over 70 clinical trials, published research, and many esteemed publications, including the Lancet, cared for patients across 4 continents, somewhere around 100,000 different clinical encounters. He's triple board certified with advanced credentials in integrative, functional, and metabolic, as well as regenerative and anti-aging medicine, and previously served as an assistant clinical professor of family medicine at Virginia Commonwealth University. And his personal focus was really profoundly reshaped by a deeply personal experience related to his adopted daughter, Anna, who was born with severe neurological injury and cerebral palsy, which was originally labeled as incurable by conventional standards. And he is the author of the 2025 book, Uncurable, which ultimately blends memoir with medical critique, practical strategies, ultimately how to challenge the modern medical healthcare system and what it defines currently as the limits of healing. A lot to get into today. Really honored to have him with us. Dr. Aaron Hartman, welcome to the show.
To be here and just kind of have a great conversation about wherever things go.
Absolutely. A lot to get into today. Before we get into Anna's story and Incurable and a lot of places we're going to talk, I'd love you just to talk a little bit more about your background, because, just taking a look at the bibliography of your clinical research on your website, I mean, you've been involved with everything from GLP-1 therapies to, the whole area of PCSK9 products, which we've profiled on recent shows, and sort of everything in between. I would just love to hear, expanding phase 1 to phase 4 studies. Talk a little about yourself. I mean, you have an incredible background in clinical research, and I'd just like to hear about that background, sort of pre-Anna days, before we get to where we're going to be going with this discussion.
Yeah, I kind of view myself as a typical academic type, scientific person I'm gonna be a doctor, right? So what do? You go to undergraduate and you get, straight A's and summa cum laude and all that kind of stuff. And then you get into medical school, and medical school just is a beast. It's a burden, and you work through it and do my residency training. And then I had joined the military during medical school to pay for school because, I didn't have all that money that kids are getting in debt now these days. It's kind of crazy how much it costs. And so I'm like, I'll just do this military thing, did that, had a great time. The military was interesting because they have this saying, no good deed goes unpunished. And it's kind of like speaking out both sides of the mouth, because it was a great experience. Every 6 months, my job changed. They can't reward you by paying you more, so they reward you with more responsibility and experience, which actually at that stage of my life was just an amazing opportunity. And got in a small private practice, and there they were like, it was run by some older individuals, about 4 doctors at that point in time, and they didn't believe in advertising. They didn't believe in internet stuff. And so I just I used my stick-to-itiveness and my grit I kind of have developed over the preceding 10 years and just, let's make a website, let's do marketing. And so over the next 10 or 15 years, we grew to about 10 practitioners. And so at the height of that practice, we had almost 60,000 patients come through that clinic in 1 year. So I was a big part of helping that grow, and just, learn one new thing every year. Every year I try to learn a new procedure, a new technique. So in many sense, I was already on like this, integrative maybe forward thinking is a better way to say it, with that trajectory. But what got me off the path was Anna, because it was not just being forward thinking at my pace when I had time for it. It was literally, we had this little 12, 14-month-old girl, severe brain damage, and this unique period of time where you can actually change the trajectory. And I knew that from my study of the brain and how it works. And so all of a sudden, I was getting up at 4 o'clock in the morning, reading articles about unrelated things, trying to connect dots. And you do that hours a day for a decade, and it radically changes how you think about things. And then, of course, apply it to patients. My wife had her own health journey. I don't talk about all this in the book. Like, my wife had 5 years where she was so fatigued that she would just literally get out of bed, do the kids for the day. I'd come home and she'd collapse, and the weekend she would just sleep in. And it was 5 years that she kind of, missed in our kids' lives because of her own health issues. My second daughter had her own story of in many ways very similar to Anna. I don't talk about her as much because at 19 years old, you'd look at her and she's normal, minus being petite. And then my son, he's the boy who lived. He actually got crushed in the elevator, had massive brain damage from that. We were able to kind of work that out, and now he's 15, and besides being a 15-year-old boy, if you know how they are, he's crazy and doing well. And so learning these things with my daughter, applying to my family, and then the practice of medicine literally is experimenting for your entire career, which is kind of cool and kind of daunting at times. And so when patients would come in with complicated issues, instead of referring them to 5 specialists, I started saying, hey, would you want to try this new stuff I'm learning? And I had a relationship with the patients, and they trusted me. So I started dabbling in it in my clinic. And over the period of the next 5 to 6 years of that, kind of started thinking maybe I should do this full time. And my wife, ever the clairvoyant type of person, she was like, you should put up a shingle and just see what happens. And I'm like, okay, I can do that. And she knew that within 6 months things would be bonkers, and 6 months that practice was halfway full. And it's been a crazy ride. But the cool thing to see throughout this has been how my daughter's struggles and her challenge has literally changed the trajectory of thousands of people's lives. And so that's been a really cool thing to see happen throughout all this. To me, that's the bigger deal, not all the bells and whistles, but actually seeing her struggle and the life that the system gave up on, my wife and I did, and how that's actually changed thousands of people's lives.
Absolutely. And before we get into sort of what you learned in sort of the early hours of the morning and sifting through sort of everything that was out there, let's just talk about Anna's story here, because guys, so diagnosed cerebral palsy, but a lot more to it. A birth mother that was using crystal meth during pregnancy. She suffers a stroke after she's born, into a drug-induced coma. I mean, sort of everything that possibly go wrong is going wrong. And then the doctors are telling you at this time, the neurologist and the specialist and everyone around the table, never going to walk, never going to speak, never going to read, require lifelong full-time care. I mean, talk about this period, because clearly, I mean, okay, this is what said, all right, now, this is not what we're going to do. But talk a little bit about that early component.
Well, early on, Anna, when kids are exposed to drugs throughout the pregnancy, there's this drug haze for her, it was about 6 months where they basically just stare off in the distance. They don't interact. It's almost like you're in like they call it drug brain or drug coma. And some kids get out and some kids don't. And the prognosis at that point in time was, this is kind of it. Crystal meth, if you know how bad crystal meth is, I mean, people who do it die young, your teeth fall out. I mean, it's just this horrible thing. And to expose a developing brain and exposing baby to that is that's horrible. And so when Anna became available for foster care, my wife said, everything's going to be okay. There's something there. She'll be fine. Now, I didn't at that point in time really realize what that meant. I just kind of trusted my wife. And because of our personal faith and religious beliefs, part of that is taking care of those who can't take care of themselves. And so it kind of was like, for me, this is the opportunity to live what I say I believe. And so I did it very mechanically, like, let's bring her in. And, me being me, I started doing like, what can I do? What are the works that I can do? Let me work really hard, and started trying to feed her. And I was just kind of into that, just all in. I never really, it's really bizarre because the way I think, I'm always planning, 1 year, 3 year, 5 years, 10 years. But when she came in my life, all of a sudden was like, what's the next 10 minutes? What's the next day, the week? My perspective changed because I went from this bigger, 10-year thing to like, okay, I've got a couple of years to work on this little girl. And I just kind of went into it. One of the things that happened that my wife knew was going to happen is I actually fell in love with Anna. When you're fighting and struggling for somebody and they become your focus, like you can't help but just become emotionally attached and fall in love with them. And part of that struggle was like I wanted the best stuff for her. And I realized very quickly that the healthcare system and I were not on the same trajectory, and I talk about the story the story in the book. After having her for a couple of months, she went back to the GI doctor, and they're like, "Hey, she's still failure to thrive. She's still less than fifth percentile." And so the standard of care, would be to cut a hole in the stomach, put a plastic tube in so you can pour formula. Tube feeding is what it is, and that's the way you make these kids put on weight. Back then I didn't know as much as I know now about nutritional medicine, but just didn't feel right. Like, why would I pour sugar water in? Where's the protein? Isn't the brain made out of fat? Where's the healthy fats? I mean, it just didn't quite, it didn't, my gut, it just didn't feel right. And so we said no. And of course, my wife informed that with all the mechanics between chewing and swallowing and how that develops the ability to talk, and how crawling is how you work into walking. My wife's specialty was kids with special needs. That was kind of actually, Anna was one of her patients. And so when we said no to the tube feed, we were reported to Child Protective Services for medical neglect because we refused to do what the specialist said. And so that was like a little slap in the face, like, whoa. Now, I just took with stride. I'm like, okay, whatever. Like, I'm not doing anything wrong. I'm not worried about it. But in hindsight, that was me being very cavalier, because sometimes parents actually lose their kids. In the special needs world, when kids have like rare diagnoses that are difficult, what will happen is sometimes the specialists will think the parents are gaslighting their kids, or a thing called Munchausen's. And sometimes the parents will actually lose the kids. And this has actually happened in our ecosystem several times. At that point in time, I didn't know enough to know that was a possibility. So I was like, whatever, worked through it. But that was like the first thing where the system doesn't like it when you say no. But the real inflection point, the real point where the weight of all this kind of went on my shoulders, was 6 months later, when my wife found a growth chart for kids with cerebral palsy. So there's actually was a growth chart for kids with my daughter's diagnosis, which you'd assume the pediatric specialist who saw all these kids in the Tampa area, right, would know this. And Anna was right in the middle. She was 50th percentile. She was normal for her condition. The specialist had no idea. The specialist didn't know. And that was like the second aha moment. And I realized I had to figure it out. All of a sudden, I created this massive distrust of what people would say. A year later, an eye doctor was saying, cut these eye muscles. Her physiatrist, physical med doctors were saying she's tight. We need to, do Botox injections, put splints on. We need to cut her hamstrings. I mean, we went to DuPont several years later, and they recommend putting a baclofen pump in her for tone issues. We've had so many surgeries recommended to us, and we've not done a single one. Anna's turning 20. The typical kid with her diagnosis at this stage in their life has had 13 surgeries, and she's had 0. Literally, we've done nothing. My wife and I laugh at this. We literally have done nothing. The specialists have. No, we see the specialists. We went to all of them, but we literally didn't do anything they said. We kind of like, okay, that's our option. We can cut, drug. Let me look and see what they're doing in Russia and China and Eastern Europe and Poland. And it's interesting what other places in the world are doing a lot of things we don't do here. So start adopting that. And over this time, she's beat every odd. She's had no surgeries, and she's actually my first child who's going to be moving out of our house this April, which is insane to think about that. And that started from that initial inch at Cape Canaveral, the being turned into Child Protective Services, finding out the experts weren't right, and then basically following our path with the way we're supposed to go. And that's changed everything for our family, for my practice of medicine, and it all started with Anna.
And you say in the book, and I'm sort of paraphrasing this, you're not curing here. You're so-called removing obstacles. You're supplying these missing inputs. And giving sort of the nervous system reasons ultimately to adapt. And again, without going, because there's so many parts here. I mean, there's nutrition. You got into the whole sort of nutrigenomics space, and we'll talk a little bit more about that. You tried some, sort of repurposing of tools like neuromuscular electrical stimulation and so forth. Some lesser, some of the peptides and all that, which is, I know, kind of a hot area nowadays. Again, talk a little bit, because I mean, this isn't just, hey, you called somebody at some local teaching hospital and you found out about X, and you found out about, dozens of interventions. And, we'll touch on that a bit too, obviously, in the clinical development world, which you come out of, when you study one thing, that's great. When you start studying two things, people get nervous. But when you're putting, 20 things together, things get complicated. And I know people say, we don't want to do that, but that may be where a lot of the answers lie, and sort of the combination approaches. Talk a little bit about that, and sort of, a little bit of this toolkit that you put together specifically related to Anna.
Well, part of my belief system is that you were made for health. Your body was made to self-heal and self-repair, and that's just common knowledge. No one disagrees with that. Being sick is not the natural state of the way things are supposed to be, and your body heals. You break a leg, it heals. You get sick, you get better, right? As you get older, that ability to self-heal and self-repair is not as good when you're 80 as when you're 8. And so it's just that basic common sense understanding. Okay, great. What are the roadblocks that are blocking your ability to heal? Is it your diet? Is it toxins in the environment? Is it bacteria in your gut? Maybe it's a brain trauma, a brain injury. You got a stroke before you're born and had drug exposure. Okay, well, how do we deal with that? How do we kind of work around that? And so that basic belief system then got supercharged with data points. And the first thing I came across was actually the idea of nutrigenomics, which you mentioned, in a different world, as in the autism world. And actually, and again, what do you do with this child? I can't find an article. I can't go to an expert on kids with crystal meth exposure and CP. Like there's not
Right.
I had to become that expert. So what you start doing is creating your own knowledge base, which was studying integrative medicine, holistic medicine, functional neurology, lipid medicine, and a whole bunch of other specialties. And I would find these experts that did these things and latch onto them, learn from them, and then incorporate what I learned from them into my toolkit. And nutrigenomics was the first one, where the idea is that some kids with some issues when they're born, like autism, pandas and pans later on, OCD, whatever. With her, it was, crystal meth exposure. Like some people are more susceptible to things like that based on your genes. You might have a MTHFR gene SNP, which is a typo. It's a little aberration in your genetic makeup that makes you not process B vitamins quite as well. You might have a COMT mutation, which is one that makes you not clear certain things like cortisol quite as well, or adrenaline. So if you get a stressor, the effects last longer. And so finding these little SNPs, maybe you have a VDR tack or fork, which means vitamin D doesn't work as well as it should, or you have a BCOM mutation, which basically your body doesn't convert natural, plant-based vitamin A or carotene into retinol. So you have to actually get animal-based vitamin A to these people. So I did a whole gene array on her. It was like 60 pages, and found nutritionally where were her weak points, these SNPs, these typos, and started with that. And then kind of spent 6 months learning that field of medicine. That led me to a pediatrician who actually specialized with kids with autism and talked about metabolic issues and gut issues and organic acid testing. And so started studying under him, and then realized there's this place called the Institute for Functional Medicine. So I started studying that. And sometimes I'd start down a pathway and stop because I found out another deviation, which was functional neurology, which led into the whole idea of, you mentioned neuromuscular stimulation. Can you train the brain to think differently or bypass damaged things from external stimuli? Can you use like electricity to a foot, to a leg, and actually help either those nerves to heal or the body to make new connections, which elite athletes do this all the time to actually improve performance. If you remember Christopher Reeve, he actually was from Virginia. He actually had a place in Charlottesville and had that neck injury, paralyzed, right? If you remember that, that's we're dating ourselves here if you remember that. But he literally was still walking with a spinal cord injury. Lots of therapy, people working with him, electrical stimulation. And one of the reasons he lived as long as he did after that injury, because he had all these inputs. And so can I take that and apply it to Anna? And the academic answer is there are no randomized trials for this. And the answer is there's no randomized trials for individuals. By definition, you can't do randomized placebo-controlled trials for people or individuals because that's the practice of medicine. You're looking at populations, you're looking at groups to get data points, but how do you actually apply that to individuals? And that's what true evidence-based medicine was supposed to be back in the 90s, taking in personal preference, like how you'd like me to treat you, up to the most up-to-date evidence, and then the clinical experience of the clinician, right? Well, modern evidence-based medicine is forget what you want, forget what I want. That's anecdotal. what is the published research say? And when you realize that half of all published research, according to Dr. Ioannis at PLOS, which is the largest online medical journal in the world, 50% of all research findings are later found to be false. And people don't realize when you only look at published clinical trials, half the time that the findings are wrong. So all of a sudden, your North Star is off half the time. Well, that's great in baseball and horrible. Batting 500 in baseball is awesome, and 500 flying planes is lethal, right? And so all of a sudden, it's like, how do you fill in these gaps? And that's what the practice of medicine is supposed to be. And that's kind of what I did with my daughter, and just filled in these gaps. And that's what I do with patients in my clinic. Someone comes in with, long COVID. Great example. I started seeing long COVID before it was even acknowledged. When it was like, oh my gosh, that's not a thing. There's no evidence for that. If you remember that, it was May 2020. I had my first patient in my clinic, and I'm like, this is kind of interesting. This is a post-viral illness that we've seen with flu. I've seen it with Lyme disease before. I've seen it with Epstein-Barr and herpes. Maybe it's related to COVID. There's no data for that. I'm like, well, I'm just going to pretend like you don't know what you're talking about, because you actually don't. And let's start working with these people and finding out that everybody's different. Some people's long COVID was related to the gut. And we now know that not having enough bifidobacteria can be part of it. Some people's long COVID was from vitamin D deficiency and other nutrient deficiencies. Many people was related to living in a moldy environment. The inflammation in the brain and your immune system from the mold environment was like putting out the sticks and the wood and everything for the fire. And then when the fire hit, it blew up. And so learning everybody has their own unique journey to whatever the diagnosis is, finding that, getting in the weeds, and then giving people, removing the roadblocks to healing, giving people what the body needs to self-heal and self-repair. And it's really amazing what your body can do when you think like that.
Yeah, absolutely. And when we look at we look at the book, and you have a statement in there. You would say uncurable is not a diagnosis; it's a challenge. And ultimately there's this continuum, right? I mean, if we go back on that, childhood leukemias and testicular cancer and Hodgkin's lymphoma and stuff like that, which were very problematic some years ago. Now say they're totally curable, but they're much more curable than they used to be. And we can put a lot of things on that, hepatitis C and so forth. Clearly, there's still some bad things on there, obviously. So pancreatic cancer and glioblastoma and all that, we got a ways to go. But ultimately, as you point out, sort of things transition from uncurable to curable, not because the disease changed, but our tools improved and we have better mechanism of understanding, and we treated so many things symptomatically. Again, you're very open to obviously challenging the medical authority that you come out of, and we're not going to burn it down. But talk a little bit about how what parts of sort of academic medicine you're still happy with, parts of it that you'd like to tear down and rebuild from scratch, others that you think we shouldn't have anymore. A little bit of, basically, if you could redesign medical training, how you would implement some of these components in the system today.
I think the reason I'm good at what I do is because in medical school, literally, I learned in 2 years, the first 2 years, I actually calculated this out at the end of my 2 years before my first board. That 2 years was equal to about 8.5 to 10 years of undergraduate education that we did in 2 years. Yeah. It's the massive amounts of biochemistry, of genetics, of molecular biology, like all these things I was told I never need in my career, but they're the foundational for medicine. That's kind of the kind of medicine I practice now. But learning that foundation was huge. Learning human anatomy, learning human physiology, learning pathology. Like this was the foundation, the groundwork for a lifelong learner practicing medicine. Our system is good at that educational point. And we have a lot of young people that are bright-eyed and bushy-tailed and ready to learn and conquer the world. They need to learn all that stuff. Problem is that you learn that, and then you get in your specialty fields and you're told you don't need to know that anymore. It doesn't apply. You only do these 3 things. It's interesting, in specialty worlds, a specialist might see 8 or 10 things. That's all they do all day long. And for me, it's like, I don't have a limit to what I do because I have to be able to see everything. That's partly part of my family medicine training was you worked in the ER, worked in the ICU, worked in the STICU, delivered babies. I mean, I worked in the middle of nowhere in a mission hospital. Like all that training prepares you for this wide world of stuff. And I think what our healthcare system is really good at is acute care. If you have a heart attack, I'm in Right now I'm in Goochland, Virginia. It's all snowed up here. The local community hospital, St. Francis, they'll put a stent in me and open my heart up within 3 hours. Like, where else in the world can you have that happen in the country, right? If you have a stroke, you got a clot in your brain, you go to Johnson Willis, which is one of the top stroke centers in the country here, right down the road, and they'll bust that stroke, get, some TPA or clot buster in 2 to 3 hours, right? And so we're really good at acute stuff. What we're poor at is, cardiovascular. How do if you have a heart attack, we can take care of that awesome. But how do you prevent it? Like, if someone's had 3 heart attacks and they have chronic angina, chest pain, now what? And that's where the long-term care, um, combining specialties, how does your metabolic health play into your neurological health and your mental health, um, with your gut? Like, what's the combination with all these? And that's what our system is really not good at. And the reality is, I think about it, and like, I needed all that training experience to prepare me for what I've then learned about connecting all the dots. And so this kind of medicine, the foundations are really super basic, real food, using food like a drug, don't put anything in your body that won't help you heal and repair, which means no partially plastic fats or oils, no artificial sweeteners, no, sugar from genetically modified beets. People don't realize that all the sugar in our system is from genetically modified beets. Only putting real food in your environment, removing toxins and chemicals from your environment. Physical activity, exercise. Sitting is the new smoking. Like, literally, physical activity activates your brain, activates hormones, all the peptide and stem cell stuff people talk about, which is really cool stuff. I've looked at the pathways, and literally through fasting and physical activity, HIIT training, you can replicate all the fancy cool stuff with all these new cutting edge, peptide things. And then having purpose and meaning in life, having, why are you here? What's your purpose? Is it just to make money and be successful, or are you part of something bigger than yourself? Like, these basic things are the foundation for long living. And blue zones, which are places where people live to be, longer than anywhere else in the world. Um, that's what they have. One of the stories, I actually met the author of Blue Zones, you know, a year ago when I was talking with him, and he tells a story about this one guy. This is an interesting story. So he was from I think Okeanos was the Greek island, came to the United States, New York, got a job, da 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 da. He was like maybe in his 50s plus or minus. Don't quote me on that age, but got diagnosed with lung cancer. And it's like stage 4, you're going to die. And he's like, you know what? I don't want to die here in a foreign country. I want to go back to my people, my place. So went back to Greece, to the little island, sat down and kind of just, hung out for a month or two. Then he was like, you know what? I want to leave something for my kids, my grandkids. I'm going to plant some olives and some grapes. So he's planted some olives, made a little olive thing, and started just going to work and doing things. And so Dan Buettner met him like 20 years later. And he was like, well, why, what happened? He's like, I guess I forgot to die. And he was just joking. He's a simple guy from the island. But so he eventually came back to the United States to see all of his doctors. All of his doctors were dead. They rescanned him. The cancer was gone. And, this is an N of one. This is anecdotal, which would be what our current healthcare system would say. But the idea of a radical remission, that cancers that spontaneously remit. There's actually a book written about it called Radical Remission. Spontaneous remission. There's over 1,000 cases in the medical literature. Like, why do people lose curiosity, about this kind of stuff? And that's what boggles my mind. If someone comes in and like, my cancer's gone, I'm like going, okay, what did you do? Where'd you go? I want to know, because maybe someone else can use that information. In our current system, with my daughter, for example, I could talk on and on. Like, for her, for example, at one point in time, they were talking about doing hip surgery on her. And a lot of kids who can't stand up on their own legs, their hips will fall out. The hip, the actually joint, the opening that your hip, the ball and socket fits into doesn't form, right, and not to do surgery to put it back in. So we started doing standing guys standard for her. We saw the orthopedic surgeon last year, and her hips now back in place. It's normalized. She's like, don't worry about it. She'll never need surgery for this. And great. I've known this surgeon for years. She's awesome, amazing. She's actually the only person in town that touched my daughter for surgery. But the idea of curiosity, like, what did you do? Why of all the kids I see who need surgery, why did this one kid not need surgery? And that's one of the things that just boggles my mind, how as people go through the system, they lose curiosity. So I tell the whole uncurable idea, and the reality is your body, you have more potential than you can possibly realize. The question is how you unlock that for your age, for your gender, for where you live in the world, for your resources. And that's what Uncurable is about, not taking status quo. It's about hope. It's amazing how much hope and having a reason for living plays into things. Man's Search for Meaning is an interesting book. Viktor Frankl. And it was interesting. He was a psychiatrist in a concentration camp. And basically, if you read the book, one of the things I got out was the only thing that made a difference between the people who lived and made it through concentration camp and the ones who died wasn't their, their socioeconomic status, wasn't their ethnicity. It was basically, do I have a reason to live,
Yeah.
to make it out here alive? And that's such a big player that our entire healthcare system ignores. And so the part of Uncurable is there are answers, and just because the first people you're working with said we can't help you, there's nothing we can do for you, all that means there's nothing they can do for you. And I've seen, my clinic has become a clinic where people will go to 5, 6, 7 doctors and they come to us and we're like connecting the dots. Oh, this is from your traumatic brain injury 20 years ago. No one bothered doing a neuroquant evaluation. Oh, this is from the Lyme disease. No one did an IGeneX specialized testing for Lyme disease. Oh, this is your long COVID. No one did a cytokine panel on you. And it's when you do that over and over again, after a while, it's kind of cool just to be the person who connects the dots and helps people get better.
Yeah, when you're talking about the spontaneous remission, it also got me thinking of, because we're talking a lot about the brain here, but this whole documented principle of terminal lucidity in Alzheimer's patients as well. Like, where does that come from? And again, thinking about the plasticity and how little we know about that. But it's interesting as you mentioned those blue zones and that that cancer anecdote. It got me thinking, because I believe at some point you moved out of Richmond to a farm for a little while, and thinking about this whole principle of ecological medicine and not just like the getting rid of the nasty stuff for our environments, but we don't think as much about the interaction with the land, with the animals. We talk a lot about One Health on the show. Can you just say a couple of words about that period? Because I think that's also very important, sort of that piece that we don't have to move to an island off the coast of Greece. I mean, there are other sort of microenvironments, let's see, near us that we can mimic sort of that beneficial aspect of ecology for our health.
We actually still live on our farm in Goochland. I'm actually looking
Nice.
at the snow right now. That's like a feet of ice. It's kind of unusual for where we're at here in Virginia. But part of our journey was in 2012, my wife, got into whole food. Let's do our own bread. Let's do natural einkorn, do sourdough bread. Let's get a raw milk. Let's make homemade yogurt. Let's just use food like a drug. Let's use food.
Right.
How can I fix my daughter's brain with healthy? I started learning about lipid medicine. I started learning about rare earth minerals, trace minerals, and their impact on health. And so we just decided, hey, we'll farmstead it. It'll be a great experience for the kids. They'll be outside in nature, have an opportunity to explore, which kids don't have those opportunities anymore. And so when we did that, let's get some cows, let's get some chickens. So I wanted to research that because I don't want to, cows a lot of money to lose, and I don't know what I'm doing. I'm just a doctor, right? I don't know what I'm doing.
Yeah.
So started studying and found some books. Sir Albert Howard wrote books, Soil and Health. Ran across Joel Salatin's work, who's
Sure.
like probably the lunatic. He calls himself a lunatic farmer. He's like the guy who started regenerative farming back in his family, maybe 50 years ago in our country, and realizing that there's this ecosystem where you eat what you ate. And how do I get rare earth minerals, trace minerals into my body? If I'm eating like a cow, where does calcium come from in a cow? And where does protein come from in a cow? Because all they're doing is eating these blades of grass that if your dog eats or your cat eats, they vomit. So
Right.
what's up with that? And so to get into it, actually, there's this ecosystem with soil and soil bacteria and soil yeast that actually create fulvic and humic acid. These acids, they're now super popular and you get supplements now, but they actually dissolve minerals. And then what happens, you get this little layer of water, aqueous layer of water around the roots of plants or fescue or grass, and they incorporate these minerals into the blade of grass. So what happens is the cow eats a lot of this, and actually that's where the cow gets its calcium, its magnesium, it's all this stuff in its system. And then the cow has this amazing ability to ferment, and all ruminators do this, and turn undigestible fiber into short chain fatty acids that make saturated fat, that make butter, that make cream. And all of a sudden the cow is like, how low can you get on the food chain? Grass to ribeye, grass to steak, grass. I mean, it's really amazing what cows actually do and how important the byproducts of this whole fermentation process are. And realize if that cow if I can supplement that cow with some kelp, it's going to be a healthy cow. It's not going to get, eye diseases and other things. But all of a sudden, the soil health is the soil acidic from fertilizers. Well, all of a sudden, the fescue is not going to get the soil will be sterile, and you won't get the same amount of minerals into the blade of grass. Or if the cow is fed grain, corn, soy, wheat that's genetically modified with lots of Roundup and glyphosate on it, because that's the way we do it in our country here. Not only will the cow not get trace some of these rare earth minerals that give it nutrient deficiencies and make it sick, it makes alcohol in its gut, which causes marbling. Wait a second. You mean all that fatty infiltration, that marbling, is not healthy? And the answer is yes. In humans, if that was in you, I would call that a muscle inclusion disease. If that happens in your liver, I call it fatty liver, or the new term is, MALFAD, which is metabolic associated fatty liver disease. We have a name for it in humans. In cows, we go yum yum. And it's like, maybe this is a really bad idea. And so learning this whole ecosystem, the quality of the water that I drink, that the cow drinks. And that was one of the things I learned from Sir Albert Howard. He actually in India learned back in the 30s and 40s that you could look at how did the locals raise plants? Did they use compost? They use natural fertilizers or chemical fertilizers? And he saw a difference in the quality of the plants grown there, the animals that ate the plants, and the people who ate the plants and animals. And so that kind of helped connect dots for me, like this idea of ecological medicine also plays in with nutritional medicine and how healthy we are. And so then I started researching, well, protein. Now, this is something I figured out maybe 13, 14 years ago that just now is coming to our radar. Many Americans are protein deficient, especially in types of protein that come from collagen and organ meat. We don't eat bone broth anymore. We don't eat connective tissues anymore. Well, as of, 2-3 weeks ago, we just flipped the food pyramid upside down. Protein's the top. People are getting all excited and upset about it, but it's like, okay, cool. Like in the high fitness world, in the elite athlete world, in the biohacking world, they've been talking about that. And also in the female menopause world, we've been talking about protein insufficiency for the last year, really hardcore. In my world, I've been using it for my patients, doing organic acid testing on them to look at their urine to see their amino acids. And it's amazing how many people have rampant amino acid and protein deficiencies who eat adequate food. And so, like, learning about the environment, learning about cows and chickens and how to raise them and how to have a healthy garden actually played in my ability to help my patients and help change their health trajectory. And it's infinitely complex, and it's really so cool. Like, I'll stop with this, but if a wife goes in the backyard, pulls out some lettuce from her yard, eats it, and she's breastfeeding a baby, let's say, the bacteria that she consumes in that plant will actually be secreted through her breast milk and set up and go into that baby's gut. So literally there's a connection between the soil, the plant, the mom, breast milk, and that baby's health. I'm like, that is a pretty cool ecosystem. And if you respect it, you can actually have a positive impact on your health. And what disrespects that is everything's processed. The milk's ultra pasteurized, flash heated to 285 degrees that burns the milk. All the coffee, oh my gosh, all the coffee's burnt. Your coffee is a superfood that can also make you sick. Part of the difference is, are you eating burnt coffee that's got these things called AGEs that age you, advanced glycation end products, or is it moderate roast? And I could talk about that for a long time as well. Like, it's interesting how a food that could be healthy we turn into toxic by the way we manipulate it. And nature and being a farmer has taught me so much about that.
Yeah. We forget those little plants growing in your garden. Very little things can tweak the phytochemical profile in directions that we want it to go. We don't want it to go, but that's it. It's, again, I love this principle, this ecological medicine that you're highlighting here. So no, that's awesome as well. Aaron, you acknowledge in the book that clearly your medical literacy gave you, a real major advantage in hunting down these options, and you understood the sort of the teaching university community, the clinical research organizations. You're able to like sift through PubMed and thousands of publications and so forth. Not everybody's capable of doing that, right? And I'd love to just get your perspective on how we best empower patients. Obviously, your practice is doing that, but we need thousands of folks like you that understand. This is this nutrigenomics is real. This is not. This biohacking trend is real. This one is not. Talk a little bit about that, because clearly, for every Aaron Hartman out there, you got dozens of celebrity biohacking influencers with no credentials talking about some stuff. We don't want them going in that direction. We want them thinking like you.
Yeah.
So talk a little bit about this as well.
Yeah, that's what drives myself and my wife crazy, because I don't have enough social media followers, so I'm not legit. I'm like, how many board certifications do I need before I'm
Right.
legit? That's just the world we live in these days. But, to your point, right now we already have a physician's shortage in primary care in our country. And if
Yeah.
every primary care physician switched right now to functional medicine, we functionally have 10 times less access to care. Why is that? When I was in my practice, I was taking care of, at the height of it, about 2,800 to 3,000 people was in my ecosystem I was responsible for. Now it's 300.
Yeah.
So in this world, we spend more time, we make things more tailored, more individual. But the reality is we're not set up to mass produce that, to get that to the population. Well, how do we get, to your point, how do we get that then to people? How do we help people? And that's where education is huge. And that's why I've got the book. That's why I've written over 400 blogs on my website dealing from hormone health, menopause, to Lyme disease, to POTS dysautonomia, to chronic fatigue, to 400 articles is a lot of writing stuff. And then my podcast, which we delve into a lot of these topics there. So, and then on the YouTube channel. So if you like YouTube, you like podcasts, you like reading, like I'm trying to get people where they're at.
Right.
And the reason is one of the principles that's true is, you know, 80% of people, if you just take the basic maneuvers, will feel better. You change your diet, you eat real food, you cut out the inflammatory foods, you do an elimination diet, you figure out, oh, I'm reacting with corn, soy. I had no idea my gut was a wreck, which is the case. Getting adequate sleep, physical activity. Toxins in the environment is such a huge, huge thing. What do you put on your body? What do you put in your body? You should not put anything on your body that you would not put in your body. Do not put any moisturizer on your body that you wouldn't just eat. That sounds kind of weird, but you absorb stuff through your skin. The BPA on a receipt from the grocery store, you can actually measure levels in people's urine. Particular cashiers have high levels, of course, from that. So all of a sudden, what you buy touches is important. So just these basic 5 concepts are the foundation for everything else I do. And the analogy I give people is it's like being a professional athlete. Professional athletes perfect the basics. They perfect kicking, soccer, kicking, passing, all the basic stuff. And they get so good at it that they're on every time. When I was in high school, my wrestling coach was kind of funny. He won nationals at VMI here in Virginia, wrestling, and he could only do one thing, and that was roll you. I remember, being during training and stuff, he'd be like, Hartman, I'm getting ready to roll you. And I'm like, you're not even touching me, dude. Well, I'd be like, old man, you're not even touching me. I said that on the inside, not the outside, because he was a pretty tough guy. And in 1 second, I'd be on my back. He perfected one thing, and that got him to win nationals. And so the idea is that perfect the basics. Yes, everybody's not gonna be able to do stem cells and peptides and all this stuff. But the reality is that stuff won't work that well if your gut's a mess, if you don't have the right nutrients in your body, if you're chronically stressed, if you have poor sleep, if you go home to a moldy house with laundry detergent, with candles burning, and there's little incense things. It's so funny. We go to friends' houses, and I walk in now. I'm like, whoa! You get hit with the nice smells from the little plug-in things, and so all of a sudden, those basic things, if people know about those, that will help 80% of people get on the path. A data point for you. If someone has Hashimoto's, which is an autoimmune disease of the thyroid, they do a gluten-free diet for a year, and this is all they do. 70% of those people's antibodies will normalize. So think about that. An uncurable autoimmune disease, uncurable, right? Doomed, you're going to lose your thyroid, medications forever. If you catch it early, you can actually make the antibodies go negative in a year just with one intervention, which is a 100% gluten-free intervention, right? So can you take these data points and give these to people? They become educated, and they become the CEOs of their health. They become the own directors of their healthcare. And that's what I've tried to create with all the educational platforms I put together, as well as online course we put together that also does labs and has some other stuff, is to empower people to take charge of their health. Because to your point, there's the fancy stuff. Yeah, if you got chronic Lyme disease, you got concussion, you've got a lot of post-concussive stuff. You still have long COVID. You've got an autoimmune issue, right? You were diagnosed with cancer, and you went through chemo and radiation. Now you've got neuropathy, or you want some things to help make chemo and radiation be less toxic to your body. You need to work with someone like me. If it's like you have just general stuff, like your cholesterol's off and your numbers off, and you feel cruddy and your gut's a wreck and you got brain fog and your hormones are off, a lot of that stuff can be addressed with the basics. And so I try to educate people, provide them with the basics, And if you want all the cool fancy stuff, that's what we're there for.
Yeah, and that's one thing I like, and we'll put, of course, the link to Richmond Integrative in the show notes. But one thing I like about your website is, you're not one of these shops that sort of has a list of diseases A through Z. I mean, you're a very common sense approach to how you address patients, and it sort of gets me thinking, going back to what I mentioned at the beginning in terms of your bio and a lot of the sort of the clinical work you've done, everything from the GLP-1s, the PCSK9s, and so forth. You're on the forefront of integrative medicine, but sort of what's in development, what's coming. I mean, what are you excited about? Clearly, when we're past the statin era, we're in this new era of lipid management. That's great. Where are we headed? I mean, are there certain diseases you're like thinking, okay, 10, 20 years out, man, we're gonna smack ourselves in the face when we think about how we dealt with X, Y, and Z down the road? I mean, what's coming? What excites you? What are you more concerned about on this curable continuum? Take us a little into the future, if you would.
I think depends on what day of the week and what week of the month you ask me that question, I'm gonna give you a different answer based on what I'm reading and doing at that point in time. So something I've been passionate about for the last couple of years has been the idea of lipid medicine,
Okay.
using fats to fix brains, losing fats to detoxify. Um, so many Americans have been consuming partially plastic fats. What's margarine? Margarine is a solid corn oil, a solid vegetable oil. It's partially plasticized. Crisco actually stands for crystallized cottonseed oil. That's what that was. It was cottonseed oil that was, literally crystallized, plasticized cottonseed oil is what Crisco is. And so we've been putting these things in our body 75 plus years. And what's happened? Diabetes, cholesterol, all these things have skyrocketed, neurological issues. I'm not saying this is the only thing, but it's a major, major player. And literally a couple of weeks ago, we said, hey, fat's back. Fat's good for us again. In the world of lipid medicine, of which the research goes back 40 plus years, fat never went away. And so just introducing real healthy fats, phospholipids, phosphatidylcholine, which the best sources in nature are organ meat, egg yolks, caviar, healthy balanced omega-3s and 6s. We need saturated fats. We need conjugated linoleic acid, right? Where do you get that from? Usually it's coming from non-burnt raw milk. So all of a sudden, getting these healthy fats in your body, that's a cornerstone from what I've done with my daughter. But most people, if you have toxins in your body from all the things I mentioned before, many of them are fat soluble and they get stuck in your cell walls and membranes because you don't have adequate fat input to flush them out. And when you do consume fat, it's the sticky, nasty kind, the nasty diesel oil stuff. It's not nice, clean, yellow, beautiful stuff. Putting that stuff in your body all of a sudden will help wash things out. And I think, we're demonizing, there's a big anti-seed oil thing going on right now. And to one part, the kind of seed oils, cottonseed oil, why is this in our food system? Canola oil, Canadian, it's actually rapeseed oil. It was used as a motor oil in the late 1800s. Like, why is that in our food system? Like, sunflower and sunflower oil, which actually are really healthy until you expelopress it, you burn it, and now you've turned, again, a healthy thing into a horrible thing. Like seed oils are a thing where we need these healthy omega-3s and 6s in moderation. In our body composition, roughly 45% of our body fat, about 50% is saturated fats, 45% is unsaturated, and then like that polyunsaturated PUFAs, which are like 3 to 5% of what we need in our body. But yet our food system is like jacked that up. And so all of a sudden, consuming the right kind of fats can be a powerful tool. You look at gut microbiome, gut issues, chronic infections, phospholipids like phosphatidylcholine are what make up mucus in your GI tract. So if you don't have adequate amount like that, you're going to be more prone to be colonized with stuff. If you've had chemical exposures and you're not making enough acetylcholine, which is a part of your parasympathetic nervous system, all of a sudden phospholipids like phosphatidylcholine can actually help balance that. So something that's really super basic, it's not complicated, actually is cutting edge medicine. And you can use it. I make this thing, I've shared this recipe online before, a brain mayo. I actually did blood testing on my daughter, found out what fatty acid she was deficient in, and then actually used the fats to make mayonnaise that she would then put on her food and consume it. And all of a sudden, over years, it's like, she's turning 20 soon. again, she was born functionally blind, never supposed to read, see, da da da. Over the last 6 years, her vision has gotten so good now that she can actually read her cell phone without magnifying it. She can actually type on it now. Um, it's amazing. Even her handwriting, 5 years ago, she couldn't even write the letter A. Now she's signing her name. And it's like these things, healthy fats have been a cornerstone for that and her. And even people with rare genetic diseases using IV versions of phosphatidylcholine, torsodeoxycholic acid, butyrate. Um, there's interesting research on that in the ALS world and these really horrible diseases. There's interesting research on that with people with like reversing calcium in people's hearts with IV phosphatidylcholine. These are things we're doing in our office. Like that is really cool, cutting edge stuff. But at the same time, our diets are depleted in these things. So it's something you can do, cool fancy IVs, which we do, but also dietary wise. And it's something that I love the topic because it's just now like, wait a second, fats are healthy for us. I'm like, yeah, they're healthy for us. Golly, Ned.
It's amazing. Everything goes full circle, but I guess that's the nature of the beast that healthcare is. But no, it's again, it's great having folks like you, Aaron, sort of re-educate the world on these issues. And I hope, you and others like you become the influencers because we need more of your voice out there, especially with your specialty background in all these areas. Um, as of the time of the publication, Anna, I think, was 19, reading, texting on her phone, speaking fluently, walking with a little assistance. How's she doing as we enter 2026? Any other updates that we should know about?
I mean, the book came out like 3 months ago, maybe. So,
Yeah.
I think the big updates, I started doing some new stuff with her, some eye drops that are actually exosomes to help with her vision.
Cool.
And it's interesting because you actually absorb them through your eye, and then eye drops go into your nasal lacrimal duct. And if you cry, you like get a runny nose. So it's actually,
Right.
it'll track through there and actually get into her brain. And so it's interesting. Her vision's actually, while I've been doing that, has been improving. And we've been doing some IV lipid therapy with her. And so what's happened is her ability to write's gotten better. It's really interesting in the special needs world. And it's really the wins, right? So in the special needs world, kids are spastic. And so when they fall, they flail back. And so these kids routinely get head injury and traumas, which can be horrible, right? But one thing that's happened is her tone has gotten less to the point now. If she falls, she actually will stop, hold herself balanced, squat down. Like it's almost like squat, drop and roll kind of thing, but she actually can control that, which like reversing that tone is not supposed to happen. It's not something that's not supposed to happen. Your vision getting better as you get older for a kid like this is not supposed. Your handwriting getting better is not supposed to happen. I had this like aha moment where because she's moved around the house and we had to interview, and this is a place she's going to. It's intentional needs community for adults with special needs, and so and they have it's going she's gonna love it. She actually is already can't wait to go. And so part of the interview process was getting admission, right? You want to make sure they're getting the right people there. And so I was on the phone watching my daughter talk. And as I was watching her, I'm like, there are glimpses of like, this is a regular, normal little girl excited about going to college, living the world, seeing the world. And there's glimpses in there where like, it was like, I could, because I knew what to look for, but I was like, she looks normal. It was just one of those things that just struck me like, oh my gosh, she continues to get better. And I want everybody to know about that. I was actually going to interview for a podcast, and I talked with did a pre-interview with the podcast. I don't do the pre-interview things anymore, but and they were like, "Well, I want to make sure you don't do these things where you tell people to have hope and you give people false dreams." And I was just thinking, that's my practice. That's all I do is give people hope. All I do is help people realize there's things they can do. And so it just didn't work out. But it's one of those things that I think just having that and realizing that if this little girl who was never supposed to walk, talk, or crawl could do it, you can do it too. And if people get that, and then just basically, one of the resources we have on the website is I've vetted over 500 books and put it down to about 70 or 80 books on this topic and other topics that have to do with health. I'm like, some are also about how we think about medicine. One, the Immortal Life of Henrietta Lacks is an interesting read about, the healthcare system and how we figured out what the HeLa gene was. And it's a really interesting read. It will challenge you no matter where you're at in your belief system. But just resources out there because people need to get self-educated and need to learn and need to being with everything out there with AI and the tools. I mean, you could literally take all the resources, use them, create your own health AI GPT and empower yourself to actually figure out stuff. It's really cool I'm really excited about the future of people taking charge of their health with all the cool tools and things coming out.
Yeah, me too. Me too. And yeah, I think it's great what you're doing, Aaron. I look forward to continue to follow you and your practice as you continue to create these novel protocols. But it's really very inspiring stuff. And I never did understand the false hope argument. You're providing hope, and you're
Yeah.
executing on it. So it's awesome. Again, for everybody who's going to be listening to this episode across the various podcast networks or who will be watching on the YouTube channel. Again, you've been listening to Dr. Aaron Hartman, Richmond Integrative and Functional Medicine. The name of the book is Uncurable, available at all major booksellers. But Aaron, again, I want to thank you for taking the time to come on the show today and talk to us for a little while about this amazing journey that you've been on. Obviously, thank you for everything you do to elevate the areas of integrative and functional medicine for everybody. And as we like to say here on our show, thanks for helping to create a better tomorrow for patients. It's really a great story, and I look forward to continue to follow you as you develop it further.
Thanks a lot for those kind of words. I really appreciate it. And I'm just want to get the message out there for people to take charge of their health. So
Well, hopefully we will help you do that.
thanks.
Be well.